So the fact that Black people in this country are disproportionately, literally getting the breath taken away from them in this moment in two very violent ways is why we're seeing this moment of uprising happen. Hi everyone, for those of you who don't know me, my name is Bernice. I am a newly graduated doctor. I'm about to start my emergency medicine training. I also recently graduated with my master's in public policy. It's really, really hard to fully encapsulate what is happening in this current moment in the world with words, but one word is breath. Breath is something that we as humans have the ability to control. And because of that, breath is the bedrock of a lot of different relaxation techniques and mindfulness techniques, ways to recenter yourself. Some of you who saw my med school graduation video might have seen that I start every single one of my mornings meditating. I've been doing it for several months. It's kind of a new practice of mine, but it has been helping me tremendously, just mentally, spiritually, emotionally, all of these things. And the fact that we have the capacity as human beings to inhale and exhale allows us to lock in, focus on that when everything else in the world is going on. All of the craziness, all of the things we can't control, our jobs, our money, family, illnesses, all of these things, it allows us to meditate and recenter. So the fact that Black people in this country are disproportionately, literally getting the breath taken away from them in this moment in two very violent ways is why we're seeing this moment of uprising happen. The two main ways that we're seeing literally forced breathlessness happen to Black communities is one, via the disproportionate rates of infection with COVID-19 that we're seeing in Black and Brown communities. And secondly, with structural violence that we're seeing in terms of police brutality and racially motivated vigilante violence. So with COVID-19, the fact that it takes away your lung function, you are literally no longer able to breathe. Why are we seeing disproportionate impacts of COVID-19 in Black and Brown communities? The answer really stems down to structural violence. We see way higher rates of comorbid diseases, hypertension, diabetes, asthma, all of these things that make somebody more prone to dying from that infection or having a very serious case of COVID-19. Those things exist because a lot of these communities have not had adequate amounts of investment from their cities, from the government. They are often, as we saw in Flint, Michigan, sourced with contaminated water, contaminated air. There's a lot of dumping that happens by companies disproportionately in these communities. In addition, we see poor health literacy because there's not enough investment in the educational structures that serve these communities. We see higher rates of obesity, which leads to diabetes, hypertension, because a lot of times our communities do not have enough access to healthy foods. High rates of joblessness, which also leads to not having access to healthcare, which then leads to poorer health outcomes. A lot of this is an unfortunately perfect storm for what we're seeing manifest today, which is disproportionate harm, specifically on these communities. And on the other hand, we have these moments that are captured on film where we are seeing unarmed Black men literally have the breath taken away from them. Most recently, we saw that with George Floyd. Not that long ago, we saw it with Eric Garner. These now iconic last words of "I can't breathe" have taken my breath away. Not to mention, we have Ahmaud Arbery, who was shot by white supremacist vigilantes on the road while jogging, doing something for his health. We have Breonna Taylor, who herself was an essential worker and was shot whenever her home was invaded, among so many other examples. We see the side right now where we have some of the most gruesome things caught on film and widely distributed and viewed, where we are seeing the effects of unchecked power in a structure used to literally take the breath, choke the breath away from community members. There is a very, very long history that has led to the current police state and over surveillance of Black and brown communities. There is a very long reading list, and I'm still myself making my way through it. But I've taken a lot of really powerful classes by phenomenal race scholars. And the sad thing is that our education system doesn't teach about a lot of these things. We basically are taught in 6th grade, 7th grade that the civil rights movement fixed everything and we're all good. It wasn't until I got to college, literally I got to college, that I learned how much, number one, the system was built to not work for certain groups of people, particularly Black Americans, particularly those who were the descendants of slaves, and how much that is perpetuated now and what we see in the current status of our prison system, the current status of our health outcomes, our education outcomes. And quite frankly, a lot of this is why I decided to, in addition to getting my doctorate of medicine, I also wanted to get my master's in public policy so that I could work to fully understand the context of what is happening in this country and work to dismantle those things that are keeping people from reaching their full potential, because it is heartbreaking. We have entire sectors of this society that want to be their full selves and want to participate fully, and they are just not at all granted that opportunity, and that is what is killing me. The unfortunate reality is that a lot of these things are going to affect, and the trauma that is accumulated from these events are going to affect certain groups more than others. I still remember a time when I was in medical school, and it was the week that Philando Castile and Alton Sterling were killed. And quite frankly, the only people in the room who were really talking about it were me and my friends of color who sat in one section of the room. The rest of the room was still going about their lives. And that wasn't because my classmates were uncaring, but the reality is, unless you are active and really tuned into the things that are happening, if you don't identify as a person from one of these groups, then these things can go past you, and your colleagues, your coworkers, your classmates are struggling. So remember to reach out. This is a really hard time. And so reach out and mobilize. We have to work on a macro level to engage policymakers. We have to challenge these systems that keep impunity for systems that continuously abuse their power. And on the micro level, do not weaponize race, as we saw Amy Cooper did in Central Park, where she called the police on a Black man and said, I have an African-American man who was doing nothing but asking her to put a leash on her dog. These are instances that we see all the time. For those who, after watching this video, feel like they're leaving with more questions than answers, number one, you're doing it right, because I'm not here to give answers. I simply just want to speak on and give a little bit more color to everything that is going on and why we're seeing so much unrest. We're seeing so much resistance to what the status quo is, because even though the status quo is working for some people, it is really, really broken for a huge subset of the population. And that, exactly that, is the problem. Keep having those questions. I'm going to link a lot of resources below, and that is just the tip of the iceberg. There are so many, many more that you can read and look into to fully understand the context of the history of the ways that this country has really set up certain groups to fail. To you all, especially to those who identify with some of the groups that have been so poorly affected in this time and have been so triggered by the devastation that's on the news, all of that, I just want to say that I see you. I feel you, obviously, on a very personal level, and I wish that this is not what we were going through. It's heartbreaking. We have to be kind to ourselves as well. All of these things are important. The revolution is long. Seeing reform and change, this is a long, a lot of times ugly, a lot of times painful, uncomfortable process. But that's exactly what it is. It's a process. Take care of yourselves. Coming up soon, I'm going to do a self-care routine, the ways that I rejuvenate myself and I take care of my mental, emotional, and spiritual health while I'm also training to be somebody who's of service. I'm grateful that you guys have tuned in. This is in a lot of ways a reflection and also a resource for other people to learn from. I will continue to use my platform to add value to your lives and also to advocate for meaningful change, particularly for the most vulnerable in our society. That is what I want my platform to stand for. And so I hope that you guys join this community. There is still so much to come. Remember to like, comment, subscribe, and I'm wishing upon all of you guys peace and the capacity to reach your fullest potential, because we all have the right to do that. Sending love, Bernice.